Hello and welcome to Seymour Johnson Air Force Base. My name is Jerome Ellis. I'm representing the mental health flight, which would be inclusive of mental health, ADAPT, and family advocacy. I'd like to talk to you about all three of those elements today. All right, so we'll start out talking about the mental health flight, and whenever it is that we look at mental health in and of itself, we want you to know that the mental health flight provides outpatient care only, and patients are seen via self-referral, command referral, or PCM consultation. Active duty personnel do have priority, but we will see dependents and retirees in the clinic, but only on a space available basis, and then they would be referred to the necessary places that would be able to assist them in the downtown arena. Our clinic most commonly is treating adjustment difficulties, anxiety, marital problems, depression, substance abuse, and family maltreatment. Our normal duty hours are 7:30 to 4:30. After hours, any mental health emergency would require you to actually go to Wayne Memorial Hospital, to the emergency department there, and they would address any issues or any concerns that you have. We'd also like you to know that we do have an on-call provider. If you were to contact the command post, they could contact that provider for you, and they could actually help to triage your problem or manage your issues or concerns over the phone. Whenever it is that you look at mental health, we are also a part of the Behavioral Health Optimization Program, commonly referred to as BHOP, and this is a organization that is embedded within the primary care clinic. And so we have a social worker that is there, we have a clinical social worker, we have a clinical nurse that is there as well, and basically what they will do is, just like you have headache, stomach ache, backache, you go to primary care for that particular reason. If you have issues with anxiety, depression, difficulty adjusting to your job, you can go to BHOP for this particular purpose before you consider coming to mental health. So what we want you to do is we want you to try to think BHOP first. Remember, you can make an appointment in BHOP the same way that you would make an appointment with your primary care provider. I'd also like to talk about our Special Needs Identification and Assignment Coordination Program. It is commonly referred to as the CNAC program. There's a medical component, and there is also a family support component that Airmen and Family Readiness Center manages. And whenever it is that we look at this particular program, if you have a dependent that has any special needs, whether that be mental health or whether that be any type of medical needs, then it is mandatory that you enroll your particular dependent in this particular program. This will ensure that no matter what base it is that you go to, that services are going to be provided for you and for your family. It also means that whenever it is you get ready to PCS from here, we're going to know about that particular condition. We're going to notify your gaining base. We're going to make sure that services are in place. We want to make sure that if you are PCSing in or you're PCSing out, that all of your family's needs are able to be taken care of. The POC for this is going to be our TRICARE operations flight, commonly referred to as the TOPA flight. A little bit about ADAPT. It is governed by AFI 44-121, and the ultimate goal of the ADAPT program is to return abusers to unrestricted full duty status or assist them with transition into civilian life. Whenever it is that we look at the Air Force and when they get involved, then they would get involved for drinking and driving, medical, domestics. There would also be self-ID, which is inclusive there, positive urinalysis, underage drinking, any duty-related incidences that have to do with alcohol or also Air Force involvement as well. Whenever we look at ADAPT, we also have self-identification, and commanders must provide sufficient incentive to encourage members to seek help with alcohol without fear of negative consequences. So if you believe that you have an issue, you believe that you have a concern as far as alcohol or drugs are concerned, you can come in and you can self-ID, but I want you to remember that you'll be held to the same standards as anybody else who will be entered into the program for any other reason. Whenever we look at commander or supervisor referred, then everyone that has a referral to ADAPT, they are going to be seen within 7 days. An assessment will be completed. Recommendations will be made to commanders and first sergeants as to how we can better assist you, your issue, or whatever your concerns are. The same thing will apply for any DWIs or any DUIs that actually come into the system or that we find out about. Remember that if you are medically referred, if you have a medical appointment or a dental appointment, if you go there and they suspect or they believe that you're using alcohol or drugs, you're going to automatically get a referral to ADAPT. So I would suggest to everyone that if you have a medical appointment, if you have a dental appointment, and if you believe that you smell of alcohol, or maybe you were drinking heavily the night before, you might want to reconsider that appointment time. Not telling you that you need to no-show, but I want you to have an awareness that that referral would be automatic if that is suspected. Whenever you look at legal and administrative consequences, please understand that those are managed by your commander or by your first sergeant. They are not managed by the ADAPT program. And so ours is simply one that is rehabilitative in nature. We have guesstimated that the average cost of a DWI or DUI to the average military member is going to be about $17,000. And we'd like for all of you to know that this is money that you probably could utilize towards something else that would be going along with your career. So we want to try to get you to avoid that if you can. So make sure that if you're going to use alcohol, try to make sure that if you're using it responsibly. And this would be that if you are going to engage in any alcohol related events, we would like for you to make sure that you have a plan. We do have a very active AADD program here. We'd like for you to try to make sure that you take advantage of that particular program. Try to make sure you maintain good habits of exercise, nutrition, and rest. It will be very, very important as far as the prevention of this type of incident. Whenever we look at active duty and narcotic medications, I'd like to point out to everyone that if you, because of the size of the clinic that we have, you may be referred to a downtown provider, and that provider may provide you with a narcotic. It is imperative that you come right back to the clinic and that you notify your PCM that you have received that narcotic. It will be annotated accordingly in your medical record, and this will ensure that if you had to provide a urine sample that came back positive or something, there would be documented evidence as to what it is that had transpired. The other note that we'd like to make here is that you need to make sure that you're not sharing your narcotic medications with other people. They're designed specifically for you, and whenever it is that you're no longer utilizing those medications, we like for you to discard them, or you can return them to the pharmacy whenever that is complete. A little bit about FAP. We are primarily the prevention and treatment of domestic violence. And so we try to prevent where possible, we try to treat where needed. And primarily what our office does is that we deal with issues of abuse, we deal with issues of neglect, we deal with issues of maltreatment. And anytime any of those issues are identified within any Air Force family, we're simply going to do an assessment of that particular situation. We're going to make recommendations to commanders and first sergeants as to how we can better assist the family and hopefully prevent those types of things from happening again in the future. We do this based upon 3 programs that we have within family advocacy. One of those is the New Parent Support Program, our treatment program, and lastly, our outreach prevention program. I want to talk to you briefly about each. We do have the New Parent Support Program. It is a home-based program, pregnancy to age 3. Any documentation that is associated with this particular program, the records are shredded after 2 years of closure. You can get marital counseling under this program. OB briefing takes place the first and third Thursday of every month. It's a collaborative effort between our office, the Health and Wellness Center, the dental clinic, and the TRICARE office. And if you come to this particular briefing, what will happen is they will explain to you all of the resources that are available for you during this very, very stressful time. The other thing I'd like to point out to you about the New Parent Support Program is we have a nurse that is totally dedicated to dealing with this population. So mom would be pregnant, or you have a child that's less than 3 years of age. She does this primarily through home visitation. And so she will come out to your home physically. She'll talk to you about ages and stages, growth and development, any issues or any concerns that you may have with that particular child. And there are also additional sources, resources, educational and support services that you can get there. Just a little bit about our DOD definitions, the difference between abuse and domestic violence. So we got domestic abuse, we got domestic violence. Remember that domestic violence is an offense under the UCMJ, and you can be prosecuted for such. So domestic violence in and of itself can be problematic for you from a disciplinary standpoint, but that would be up to your commander or your first sergeant. Just a little bit about our North Carolina child abuse reporting law. And so anytime that we get an allegation that comes into our office, we're going to put it into one of 4 categories. The law is going to apply to any juvenile that is under 18 years of age. The law specifies that the abuser can be a parent, the guardian, the custodian, and or a caretaker. And I would like to point out to everyone that Child Protective Services can come onto our installation 24 hours a day, 7 days a week, anytime they suspect issues of abuse, anytime they expect issues of neglect. And what we'd like for you to do is, if a report is made and it is involving your family, if they were to knock on your door, we want you to be as cooperative with that process as you possibly can be. They would refer to us as family advocacy as a reason. Once we find out about it, we'll get engaged. We don't want you to be concerned about whether it happened or whether it did not happen. We just want to ensure that you cooperate with the process. Remember, children cannot protect themselves. A little bit about Child Protective Services as well. Remember again that they can come onto the base 24 hours a day, 7 days a week, but they can do the same thing off of the installation. Your goal is going to make sure that you are cooperative with them. We do have an MOU with Child Protective Services. If there are issues or concerns and it involves any Air Force family, then we would be notified and we would start working collaboratively with them on the issue or the concern. We'd make sure we educated you along the way. A little bit about our on-base youth supervision guidelines. If you live on base, we have a document that you're going to receive today that sort of identifies for you what children can and cannot do here on the installation. Starts out at the age of 1 day, goes all the way up to 18 years of age. It identifies for you whenever it is that a child can be left home unattended, whenever they can walk to school unattended, left in a car, when one child can sit the other, when they can be outside playing alone, when a child can stay overnight by themselves. It explains just about every possible scenario. It is imperative that if you live on the installation that you gain a copy of this particular document. If you live off of the installation, I guarantee you, if you were to follow these guidelines, very seldom would you have issues or concerns as far as Child Protective Services goes. Remember, the responsibility for safety, care, well-being of the child, it remains with the parents. It is not with the child. A little bit about our maltreatment intervention process. We do have restricted reporting in our office. If you are under the impression that you're in an abusive relationship, you'd like to get out of that particular relationship, and the issue for you is you don't want everyone to know about it, such as your command, leadership, or anyone else that is associated with the installation. If you were to come to our office, if you were to come anywhere in the medical group, if you were to talk to any of the chaplains or the SARC, there's a possibility that we could offer you a restricted report. It would not apply if you have children that are in your home that we feel that might be in danger. It would also not apply if we couldn't ensure that you would be safe. But we do have a victim advocate in our office that would assist you with any issues or concerns that you may have, whether that's legal, whether that's housing, whether that's child care, transportation, employment. She would work with you on all of these particular issues. So make sure you have some awareness of restricted reporting and our victim advocate program. So you suspect one of your coworkers or your friends of being abusive, what do we want you to do? Make sure you ensure safety of the victim. Do not confront them unless you feel the victim is in immediate danger. And then most importantly, report your concerns to your supervisors, security forces, and or family advocacy. Lastly, as far as our outreach program is concerned, we'd like for you to know that each and every month we're going to offer some activity that deals with the family. So we have parenting, moms, pops, and tots, parenting the newborn classes, breastfeeding classes, scooters play group. We have our Dads the Basics class, anger management, couple communication, how to avoid marrying a jerkette, and then our family advocacy strengths-based training program. All of these activities are offered to you absolutely positively free of charge, but they're only as good as your willingness to engage in them. So try to make sure you take advantage of the many, many prevention programs that we have here at Seymour Johnson Air Force Base. If you have issues, you have concerns, you feel like you need to contact us, then this would be our contact numbers. Feel free to pick up the phone and call us at any time. Remember, we do have an on-call provider. If you feel like you have a mental health emergency, you could contact that person through the command post, and we would try to address any issues or any concerns that you might possibly have. If you have any questions, please feel to give us a call. Thank you.